Hello, everybody. I'm Tara Haelle. I'm the Health Beat Leader for Infectious Disease for AHCJ. We're going to give Zoom a moment or two to let everyone join before we get started and I introduce our guest and topic. So sometimes Zoom takes a little bit for everyone to come in here. A reminder that we are recording this session, so you will have an opportunity to view it later if you'd like. Give it a moment here. I'm trying to see if I can see where the number of people are. There we have. Okay, participants who have come in. So time for more participants to join us. While we're waiting for participants to join us, a reminder that when you have questions, when we reach the Q&A, to put them into the Q&A box and not into the chat box, because I will be looking at the Q&A for questions. Give it a moment here. Okay. All right, we'll go ahead and get started. Again, I'm Tara Haelle. I'm the Health Beat Leader for Infectious Disease for AHCJ. This webinar is one in a series of topic-specific training opportunities to brief journalists on the latest information in a particular health area and to give you story ideas or story resources that you can use in your work. A reminder again that we are recording this session, so you will have an opportunity to view it later. Today's topic is reporting the respiratory triple threat, preparing for flu, COVID, and RSV season. If you are a longtime veteran health journalist, you know that we have the annual flu season stories that we all kind of were used to doing every year. Debunking myths about the vaccine, reminding people to wash their hands. And now, since COVID and since having greater awareness about respiratory syncytial virus and the new RSV vaccine, it's really each year, instead of the flu season, it's the flu, COVID, RSV season, since they all overlap. And of course, it's possible to have all of them at once. The challenge, of course, is that people have COVID fatigue, and I think some of that fatigue has leaked over to flu and fatigue. And I don't even know how many people still have a good understanding of what RSV is, although there's certainly greater awareness than there was. But that is why we have joining us today Dr. Demetre Daskalakis, Director of the CDC's National Center for Immunization and Respiratory Diseases. We're going to open with Dr. Daskalakis telling us a bit about what to expect for the season, any resources that the CDC can offer and what their role is. I will then ask a few questions for him to respond to. And while I'm asking those questions, I encourage all of the attendees, if you have questions, to put them into the Q&A space, which is separate from the chat space, and I will direct those questions to our guests. So, okay, Dr. Daskalakis, I just did it again. I added that extra S there. Demetre, let's go ahead and get started. Thank you so much for joining us from ID Week, the Infectious Disease Week, the big conference for infectious disease each year. I really appreciate you taking the time out. Why don't you go ahead and get us started?
Great. And thank you so much, Tara. And you did great pronouncing my name. It's all good. So thank you for including me here. So I guess starting off, I think what we really want to do this fall and winter virus season, which is what we call it, since there's so many viruses that can be involved now, is to really help encourage people for how they can risk less severe illness and do more of what they enjoy. That's going to be a lot of the theme. Let me see if I can point in the right direction. Up here, you can see this risk less, do more. And that is really like our umbrella, our strategy in terms of how we communicate why it's important to pay attention during a respiratory virus season and why we have the tools to be able to really improve folks' experience during it. We have more and better tools for protection from these serious respiratory illnesses than we ever have. So you talked about the flu vaccine. We've had that for a while. COVID vaccine now we've had for a few years, and a lot of new and exciting products in RSV. One of the things that we really want to highlight, and we'll talk more about who needs to get vaccinated in more detail, but really, there are people who really need to make sure they're getting vaccinated. And that really, I think, are folks, especially if they are over age 65. I would say older age, but as I gently enter my sixth decade, I feel like that's looking less and less older. Most deaths from flu, COVID-19, and RSV are in fact people who are age 65, and the risk gets bigger as the age gets larger. So I do not have a good crystal ball to tell you what's in store for this fall and winter virus season. We think, looking at our modeling, that we expect to have a season that is around the same or maybe a little bit better than last year. That, of course, assumes that we don't have any curveballs, like any new variants of COVID, any changes in flu. But what I do know is that forecasts are forecasts, and unlike weather, we actually have the ability to change the direction of that forecast if we increase the number of people who are protected against viruses that we are able to protect against. And so I'll highlight that it is really important for everyone older than 6 months of age, that's 6 months of age, to get this season's flu and COVID-19 vaccines. On top of those two, if there's an adult who's 75 and older, and individuals who are 60 years and older who have certain health conditions, or if they live in a nursing home, they should also get their 1 dose of the RSV vaccine. That, remember, is not an annual vaccine. At this point, it's recommended as a one-time. So what we're seeing so far this year is that the numbers of acute respiratory illnesses causing people to seek healthcare nationally remains low. We are at the beginning of the season, and we're starting to see the signs that it's moving. And what we tend to see is that flu and RSV increase in parts of the South, and then they start to sweep across the country, and it's starting to happen now. We're seeing some increases in parts of the country, specifically in the sort of southeast of the country, where we're seeing increases in RSV, particularly in young children. Now, COVID positivity continues to be low, as are the ER visits. Again, we're sort of through that summer hump that we tend to see, but that won't last for long. We forecast that that's going to be coming back as it does, as we've seen in the last few years. So I think, though we have a reality where we have COVID, flu, and RSV, and those viruses circulate, we have the ability to alter that reality. So even though they are still with us, that we can minimize the health impacts that those viruses can have, whether that means go into the doctor, the emergency department, other healthcare provider, hospitalization, ICU admission, and in the worst scenario, death. So, I think we know what the flu vaccine can do, as an example. So just this last season, with coverage that is around the 40 to 50% range, flu vaccination prevented at least 7.4 million flu illnesses, nearly 4 million flu medical visits, 100,000 flu hospitalizations, and around 3,500 flu-related deaths. Now imagine if we got our influenza coverage higher than 40 to 50%, how much better those numbers would look. Again, flu virus is going to circulate, but we don't need to have people hospitalized or even worse. And we can prevent that by vaccine. Additionally, COVID-19 vaccinations probably prevented between 40 and 100,000 hospitalizations. And looking at the whole story, about 3 million lives have been saved by COVID vaccine since we've launched COVID vaccine, and about 18 million hospitalizations. The other important population that we should talk about even more are pregnant women, because we know that vaccination actually does a couple of things. So COVID and flu vaccine does two things. It protects the person who has the pregnancy, but it also means that that mom through the placenta gives a really great gift to the newborn, which is antibodies that will protect them for the first 6 months of their lives. So really important. And on top of that, we also have RSV vaccination for people who are pregnant, so for in pregnancy. And the effect of that is not so much for the mom. Moms don't tend to have bad RSV disease, but it is a huge benefit for the newborn, who can be protected up to 6 months. And if there's not that, we also have immunizations that are available for newborns that are monoclonal antibodies called nirsevimab that can also protect. So I think that the theme is risk less, if I can point in the right direction, risk less, do more. And that means, even if we have these circulating viruses, we can change the forecast by making sure that more people are protected using the vaccines that we know work. Tara, that's my opening pitch here in terms of our conversation.
Fantastic. And I really like that risk less, do more, because I think that really speaks to you hear the people say things like, well, why should I get the vaccine? And it's not for most people, it's not get the vaccine because it'll stop you from dying, because that's not the issue for most people in the big picture of the whole population. So saying things like, well, so that you can go to that birthday party that you didn't want to miss, or so that you can actually, not have to use up your sick days. That's a cool angle that I actually haven't seen much. And it kind of leads well into my first question, which was, what do you think are the most important messages journalists can communicate? I think you actually just covered all of that. So I don't know if there's anything more to add to that, unless you have suggestions for other ways. I will say, one of the challenges I think we have as journalists is that whole COVID fatigue, which is now like, I would just call it respiratory fatigue, frankly. I think it's kind of expanded. The risk less, do more is kind of a nice twist on that to sort of get over that. Do you have other suggestions for how, when you're talking to people, are there ways that you try and break through that fatigue?
Yeah, no, I mean, I think again, this is sort of where I like move my public health hat over and put my clinician hat on, which is I think that a lot of what needs to happen is to really be really clear and transparent about what the vaccines do and what we know about them. And so I feel like the same way that we communicate, like, in the doctor's office when I see my patients about flu vaccines and RSV vaccines and COVID shots, I think that it's very similar. I mean, I think the most important thing, I think, from the perspective of reporting is, people, I think part of the fatigue is that I think folks have forgotten really what the burden of disease is for these infections, and just how many people, are hospitalized and how many people like have like bad outcomes. So I think reminding people like what the burden is, and then also saying that we can, again, like how I said it, that we're able to really take, that forecast, and if we can nudge the numbers of people vaccinated even a little bit, it means that like more grandmas are going to be able to be at the Thanksgiving table instead of the ER, right? More young kids are going to be able to, have their first like Christmas or Hanukkah morning or whatever they're celebrating at that time, rather than being in the emergency department getting a nebulizer treatment because RSV is causing their airways to tighten up. So I feel like that is, I think, really important. And we know, again, the vaccines, they prevent severe illness. And, I would much rather have my loved one or myself have a sniffle than have like something that requires me to go to an urgent care emergency room or worse. I think also, part of this is also like framing this in the context of like all the things that you can do to prevent respiratory virus infections, right? So vaccines definitely number one for the ones that we know that we can prevent. But it's a soup of viruses out there this season. It's not just or maybe a stew of viruses this season that are just out there, and we have vaccines against some of them, but not against a lot of the other ones. And though they aren't necessarily responsible for a large burden of disease, they sure are responsible for a lot of people feeling crummy. And so like reminding people about the other things, like improve ventilation, like get tested if you have symptoms, and think about treatment, like washing your hands. I know that that's like lower on the list, but really an important core thing to keep you healthy. And my really big favorite one, which is, I in my life have demonstrated my strength by showing up to work sick. And that was not a good idea. And so like, I feel like, especially after COVID, I think we all know that if you're sick, stay home is a really powerful piece of advice, and really helps people to prevent transmitting. I think also, I said this a little bit, and then all the other things, right? So not forgetting, you can like, stay away from people if you're feeling sick, even beyond staying home, like give some distance. Like if masks may be the right option, think of masks, adding testing into the mix. But I think the other part is that like, we know who should be vaccinated, and it's like pretty clear. The guidelines are pretty, or guidance is pretty clear. But like, I like to say to my patients, like, everyone over 6 months old should be vaccinated for flu and COVID, but you especially need to be, because of the things that we know happen to folks who are older or have underlying conditions. I think, again, we also covered the importance of vaccination in pregnancy, and like how that really does not only protect the pregnancy, but also protects the newborn. And I think the last two things, Tara, that I think are important, and I think what so much of this risk less, do more sort of strategy and campaign are about, are really to remind people that, vaccines are tested. Like, and we know that, vaccines can have side effects. Most of them are extremely mild. I got my COVID shot, my arm was sore, but when I had COVID, my sore arm would be the least of my concerns. And so thinking about like how the vaccines, even though they may have some mild side effects, are really important in preventing the absolutely not so mild side effects that we can see with these respiratory infections. And then again, the last part is like, the more we can talk about these infections, the more we can talk about vaccines together and be as transparent as we can be, the more we can fight the sort of misinformation that's out there, because there's some really dangerous consequences to that misinformation. I mean, I think one of the things that I quote a lot is the finding that somewhere between, depending on when we did the cutoff for the data, somewhere around 95% of people who were hospitalized with COVID-19 did not have an updated COVID shot. Now that is like that is like a pretty impressive data. So a lot of sort of mis or disinformation that sort of comments on like there's no role for vaccine, it speaks against it, because the hospital was full of people who did not have an updated COVID vaccine. So again, I think those are, and like, you can find this vaccine, and I think there's lots of ways to do it. Go to your healthcare provider, talk to your healthcare provider, but also vaccines.gov is a great resource to at least identify some of the places where vaccine may be stocked. That was a really long answer, considering I already answered your question.
You actually went into my next two questions, which is great, but I want to address things you mentioned. You mentioned the side effects. And one thing I tell people, by this point, most people have a sense of how the side effects will affect them. And for some people, it does kind of knock them out for a day, where they have a fever and they need to spend maybe a day kind of relaxing a bit. And some people may take a half day from work. But if you know that, then you can also plan ahead, right? I mean, my husband, for example, he has immune compromised, and the COVID shot always gives him kind of, he feels pretty crummy. So he gets it on the weekend, he plans accordingly. So that's something I think that you can take into account. I do think there's a big disconnect a lot of the time between the vaccines in terms of what they do and what they don't do. Most of us kind of grew up thinking of vaccines as, you get the vaccine, you never get the disease, right? I got my measles vaccine, so I'm not going to get measles. My parents had the smallpox, and that's why they didn't get smallpox. And I think that we need to sort of shift a little bit in educating the public in what vaccines actually do, that, some vaccines can actually prevent you from getting disease. Yes, that is what the measles vaccine does. I tell people, don't get the flu vaccine to prevent you from getting the flu, because chances are it probably won't prevent you from getting the flu. I say, and I know that doesn't sound right at first, but then I go on to say, get the flu vaccine so that if you're exposed to the flu and you do end up getting it, you don't end up in the hospital, or you only take a day off of work instead of 5 days off of work. So I kind of emphasize that. Can you talk a little bit? I know with the flu vaccine, it's about, usually it cuts the risk of infection in about half, and it cuts a lot of other stuff in about half. We usually think of it about it ranges in the 40s to the 60s, but the 50% range. I don't know what those numbers are for RSV, and I don't know what those numbers are for pregnant people, or, for infants, I guess, or for adults. I also don't know what those numbers are for the COVID vaccine, especially when we have the new variants coming out. We have a new one that was just announced. I think people are probably wondering, how effective is the current vaccine when we have the new variant that just came out, and how effective is it in general? So can you talk a little bit about the number we know in terms of effectiveness of the COVID and RSV vaccines?
Sure. I think your flu assessment is great. So I think it's generally it looms somewhere in the like 40-50% range. And that sort of tends to be what we see. Again, remembering that's like additive. So that's like what that adds above not having a flu vaccine. And that I think is significant. I talked about the impact on burden. So even with like something in that range, there is like significant impact in terms of reducing like burden of disease. So that's number one. So COVID, well, actually, let's do RSV first. So for older adults, that really the data really show about an 85% reduction in severe RSV disease. Does not, again, note that that's the outcome. It's not prevention of RSV because again, all of these, what they do is they take the infections, COVID, flu, and RSV from like a wild thing to like a tamed thing, right? So it's like not a mean lion trying to get you, but a little kitten.
That
And so
tame,
they
don't kill it, but tame.
all all three of them do it, like, and so that's like, so and like just to add like another dimension, like we know that there's protection for newborns whose mom got the RSV vaccine, and that's like on the order of about 75+%. But the other option, if they don't get that vaccine, nirsevimab, the immunization, our studies actually show that it's closer to 90%. So like we have really good strategies for RSV for sure. COVID, depending on like what your endpoint is, there could be up to about 75% reduction in acquiring COVID in outpatients. I think when you look at sort of medically attended COVID, like thinking about severe COVID, you get well over 50% reduction. And so it really is pretty impactful. So I think that like the bottom line is that when you have that these vaccines, and I think you hit it on the head, the nail on the head, like they're not every vaccine is the same. Like there's some that we use that shut it down, like measles, mumps, rubella shot, that measles vaccine. I think that's your example. Like that has 97+% effectiveness in people who have 2 doses. So that's great. In terms of like these other vaccines, we're looking at a different endpoint. Like though we do look at prevention of infection, and they do work to prevent infection. We're really interested in what happens in preventing the more severe outcomes. Now, what about XEC, which is I think the variant that you're asking me about? There's like a new variant in town that's circulating. So probably good to sort of level set that we don't know about vaccine effectiveness until we actually have like the season. So like what we instead do is look to see like how we can forecast how well the vaccines are going to work, given what the new variant looks like. So interestingly, this new variant, and this is probably more than you wanted to know, it's not that new. It's like it is like a combination of two JN1 variants. And so what that means is that the surface of this variant looks very similar to JN1 and KP2, which are the strains that are in the COVID vaccine. So again, we won't know vaccine effectiveness until much later in the season, but at least based on the structure of these viruses and what we know we've got in the vaccine, I think that we will have like really good protection from the strains of vaccine and the virus in the vaccine, the strains selected, the antigens selected in the vaccine to protect from that variant as well. Now, that's why it's important that we keep watching variants, and we do like at CDC monitor very closely so that we're able to sort of provide any like midstream forecast changes or potentially more guidance in terms of vaccine policy.
Great. And we already have good questions coming in. I'm going to start going through some of those questions. They're really great questions. Some of the ones I had for myself. So if you do have a question, put them in the Q&A. We'll try and get to as many as we can. I'm going to skip around them based on where we've just been talking. So I'm not necessarily going to go in order, but this is a really great question from Tracy Russell. How do working adults without health insurance access these seasonal vaccines now that the pandemic era free injections are no longer available? And I know one of our CDC individuals just put in there to remind everyone to go to vaccines.gov to find out where they are, but I don't know if that tells us how to pay for them. So what do we do?
Great question. So first, it would be remiss for me not to to remind everyone that in the president's budget for 2025 is something that's called Vaccines for Adults. And that program is very similar to Vaccines for Children. Vaccines for Children actually is the program that covers uninsured kids and actually kids on Medicaid as well. And so, there's no child under 18 who shouldn't be able to access ACIP approved vaccines. The horizons are a lot different for adults. And so we don't have a program that does that. But this year, we have identified additional resources that have gone to health departments to be able to support COVID vaccination. Again, that is another year-long fix. So really support for the Vaccines for Adults program is really important to be able to have a more durable solution, not only for COVID vaccine, but also for other ACIP recommended vaccinations. In terms of flu and RSV, couple of strategies for under or uninsured individuals. The first is call your health department or connect with the health department, look online, because very often they do support flu clinics and other vaccine clinics for people who are underinsured. And then the other really important thing is to think about places that actually serve underinsured people, like thinking about some free clinics, which I know are accessing some of these vaccines, but then also community health centers. So, previously known as FQHC, but community health centers that in their mission really have support of underinsured individuals. And I know they have robust vaccination programs for all the respiratory vaccine and viruses. So I would put those three on my list, but then again, ring the bell again for the importance of a Vaccine for Adults program if Congress deems it appropriate to support it.
Next question is kind of a three-part question, but it's all dealing with the same thing. The timing of vaccination and the literal placement of the vaccine, which is to say, how long after, I had COVID at the end of July. I have not gotten my COVID vaccine because I had COVID at the end of July, but I don't really know how much longer I'm in that little sweet spot of not necessarily being, I mean, I'm not bulletproof, I know that, but when should I be looking at getting it now? It's October. Like when, how long after you've had an infection should you be looking at getting the vaccine, especially since we have sort of a two-pronged season with COVID, since it's often like there's a summer surge and then there's the winter surge. So that's part of the question. But then along with that, when should people get their flu vaccine? I've even had healthcare providers tell me to wait until mid to late October to get my flu vaccine because it might last for longer of the season, since a lot of the season hits high in January, February. And then what about getting them together, getting the RSV, the COVID, and the flu vaccines together, getting them all in one arm, one in each arm? So I know that's a lot of questions all at once, but they kind of all
together.
So
You may have to remind me if I miss a part, but let's start. I think we're good. So the first part of the question is about how long to wait after you have a COVID infection. So this is like a little bit of a gray zone in terms of how long. You can choose to wait up to 3 months, but if there's a circumstance where you want to get the vaccine before, that's also okay. And I'll give an example. Like I had one of my patients who was going to be traveling, and they were like, I'm going to be on lots of airplanes and in a lot of crowded places, and I know that there's maybe COVID flying around. Should I wait or not? And I think ultimately they made the decision that they were going to get the vaccine earlier than 3 months, but the recommendation is consider waiting 3 months, realizing that one is like a little bit of a gray zone, and that people are able to sort of decide for themselves or with their clinician if there's a reason to get it sooner. So I mean, again, there's some theoretical downsides to getting it soon after an infection, but if the practicality ends up being sort of more significant to get it sooner, then the answer is get it sooner. That also speaks to question 2, which I think was about timing for flu shot. Is that good?
Yeah.
So I think that really any time like in fall is an appropriate time to get a flu shot. I think that that the main message is that as long as flu circulates, it's never too late. So I think that at the end of the day, I think that the guidance of trying to get the flu shot when it's, convenient. Like if you have like a doctor's visit or a provider's visit or in the pharmacy and September feels good, there's no reason not to get it in September. If for some reason like October feels better, that's okay. But if you haven't gotten it and we still have flu circulating in February, it's never too late to get the flu shot. Now, the last part of the question is co-administration. And so we have a lot of data about co-administration of flu shots and COVID shots. And that data is really supported that it's a best practice. So we don't see that there's a lot of downside. Now, good, however, to be fully transparent, will your arm maybe hurt a little bit more? Will you potentially feel a little crummy for a day? The answer is you may, and co-administration may make that a little worse. But if there's only one bite at the apple, get both shots at the same time. If you are like, well, maybe I don't want to have like a sore arm or feel as crummy like for a day or a limited time, the other option is to just space it out by a couple of days or a day. So you don't even, there's no waiting period between a COVID and flu shot. If you got one on Monday, you can get the second one on Tuesday. So I feel like co-administration is a great practice. Now, RSV, we have less data in terms of like co-administration. We do have some data on RSV co-administration with flu shots and the protein products that we've got out there. Like we have some data on that. So that's like the Pfizer product and the GSK product, less data on the mRNA product. That looks like it is both fine to get from the perspective of side effects and doesn't have an impact on the immune response to the vaccine. And CDC continues to monitor safety, and we're not seeing any safety signals related to co-administration of RSV. So it's really it is a buffet of options, which is if you want to get them together, go for it. You may expect that you're going to feel a little crummy for a couple of days, maybe a little fatigue, maybe your arm will be a bit more sore. If you don't want to get them at the same time, you don't have to wait ages. It can be like, serial one day after another. And that's it. I think I covered your 3 questions.
Yeah, I want to expand a little bit on one of those. Could you clarify again? You were saying we have less data on the RSV, but should people get all 3 together, or like is that okay?
It's like really a good practice, especially if like, if you aren't going to be able to go back for another visit and you want to, from the perspective of what we see in terms of side effects, it's safe. From what we see in terms of immune response, it's safe. And we're not really seeing any sort of signals in our safety monitoring. Again, so it's like, but again, it is such a personal decision. Like I really wanted to get my flu and COVID shot at the same time, but I wasn't able to because I had a very publicly administered COVID, flu shot, and I wasn't able to get the COVID shot at the same time because of logistics. So I got my COVID shot. Yeah, I got it I got it pretty soon thereafter when it was convenient for me. But, I think that, I recommend to my family and I recommend to my friends, it's totally okay to do all at once. And I recommend that to my patients as well.
What about effectiveness? Do we know anything? I've seen like scattered studies here and there, but none of them were very large or definitive in terms of like, is it more or less effective if you get them at the same time, or does it matter if you get one in one arm and one in the other arm? Is there a difference?
Yeah. So I don't think that the location matters, except that I personally recommend, if you can, do one on one arm and one on the other arm, because then you also know, like, oh yeah, now I know that the COVID shot may make my arm sore. And if it's just the same arm, like, just good for your future planning of what you're doing with vaccines. Like what you said, like if you know what to expect, it's easier to plan. So that's one. And the other thing is, at least the COVID and flu does not look like there's any interaction that would change the immune response. The RSV and flu, where we have data, and that's like for the Pfizer product and the GSK and the GlaxoSmithKline product, the immune responses seem to be good, no matter for flu and for RSV. So it doesn't seem to track to any impact on effectiveness of the vaccine.
Okay, and then another question on the vaccines, and this was actually the first question asked, so I'm glad to finally get to it. My apologies. Thank you, Alexander, for your patience with this. Why do you think we've seen an uptake of flu vaccines outpacing the COVID vaccines? There's been a lot of reporting on the fact that COVID vaccine uptake is really low. Especially given that it sounds like the COVID vaccine has a little bit better effectiveness from what data we have of the flu vaccine. That seems surprising, and especially again, given that the COVID infections, I mean, I don't know how they compare to flu infections these days, but often, I mean, at least for me personally, COVID knocks me flat, and flu does not knock me flat like that when I've had the vaccine. So can you talk about like why we're seeing that gap, and are we also seeing that gap with vulnerable populations, like in nursing homes?
Yeah. So I think that we have I think the global we have a lot of work to do from the perspective of making sure that people know the importance of vaccines. And I'll do I gotten good at pointing. Just to sort of highlight again the sort of comment about risking less and doing more. I think we definitely see that I think folks are potentially more comfortable taking the influenza shot than they are taking the COVID shot. And we have data from our National Immunization Survey that really does show that there is more willingness for a flu shot than there is for COVID shots. But again, I think you brought up a really important point, which is that I don't race the ugly dogs really in the competition. Both are terrible infections that we need to avoid. But I do think that COVID vaccine is highly effective, and also based on all of our monitoring, is something that has, for most people, very time limited, tolerable side effects. Obviously, there are rare events, but there's also rare events with flu in terms of side effects. But that's sort of where this like risk less, do more also comes from. When we think about vaccines and the way that we recommend vaccines, it's really about that risk benefit ratio, and the benefit is far greater by orders of magnitude than the risk of any of the more rare side effects. I think that we definitely hear, looking at our national immunization survey, that people are less inclined to get a COVID vaccine, and then that tends to be something that we see impacting populations pretty differently. I think one notable finding is that we see not that folks who are in rural parts of the country seem to be more disinclined to get a COVID vaccine than folks in less rural parts of the country. And I think that part of that is why we're doing this campaign at HHS to really better teach people what the vaccines do. And I think and to highlight that this is a bridge to being able to do more. And so I think that I think that that sort of creating this sort of package of things, I think in the long run will really help us to really make it a part of our normal behavior, that you get the flu shot, you get the COVID shot, and if you need the RSV shot, you get that too. And so I think this is still COVID is still fairly new on the scene. And so I think that that as we sort of more normalize what the sort of normal thing to do is around the season, I think the more we'll be able to sort of encourage people to do the right thing for their health as well as the health of their loved ones.
I'm going to veer a little bit into a dicey area, but you'll understand. Don't get too nervous yet. You pointed out very tactfully that rural areas tend to be less likely to, and I already know you know where I'm going with this, less likely to get the COVID vaccine. We also know that rural areas tend to lean a little bit more politically conservative, a little bit redder, and that there have been several studies that come out that show us that there's a little bit more vaccine hesitancy among people who tend to veer more conservative, which often is all going to be people who are more vulnerable in different ways, either because they're older or because of their location, or less access to healthcare providers. Does the CDC have any thoughts on what journalists might be able to do in terms of when we're writing our stories, messages that might tap through that and overcome some of the unfortunate partisanship that's kind of entered into the, I'm not trying to make you get political here. I'm just
You're good. You're good. I feel like this is the drumbeat, which is that I think that really going back to the source and saying what these vaccines do, what they prevent, which I think is so important. I feel like we know from our data that people don't necessarily have really good risk assessment in terms of what the risks are to themselves and their family. And so I think that definitely sort of highlighting the fact that flu, COVID, and RSV, RSV causes like 100,000 hospitalizations in older people a year, right? That's like that's a lot. Right. That, I mean, like if we had like another virus circulating in the country that caused 100,000 hospitalizations, like I feel like there would be a very strong drumbeat, especially if we have the ability to prevent it for vaccines.
7,000 deaths in older adults as well, right? So somewhere in
Yeah.
that range, I think.
Yeah. And so I think that that like the drumbeat of like what we've got, that these are serious infections that happen every year, and that we have vaccines that are tested that may have side effects, but the benefit definitely outweighs the risk from the perspective of like the infection being way, 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 way worse in terms of outcomes than any side effects that we see with the vaccine. I think that's like that's what we should do, because I feel like, at the end of the day, the vaccine doesn't differ, the viruses don't differentiate who people are going to potentially vote for in an election. But they do definitely cause a lot of havoc in people's lives that can be really easily addressed by making sure folks are up to date with the vaccines that we know work.
And one follow up to that, are we seeing any differences in COVID and vaccine uptake? Sorry, COVID and flu vaccine uptake in nursing homes, which are going to be obviously your most vulnerable population? Is there a similar gap there, or do we not
Yeah, I
know?
mean, I think
Not
we
on that.
we do we do have some data on that, and I think we saw last year we did have did have coverage that was reported on in nursing homes. We're seeing an uptake. We actually engaged really closely with our nursing home colleagues over the last year to really help support better deployment of the COVID vaccines this year. Again, last year was our first commercialized release of COVID, and I think there were lots of lessons that we learned, and like the great news is that we're hearing that the nursing homes aren't having problems ordering and accessing COVID vaccines. So, and we've also supported them by again doing some great things with Risk Less, Do More with this campaign, because along with sort of the general population, the stuff that we've done on like TV, radio, print, social, I think we were even like this. Risk Less, Do More even made it on the Emmy Awards. Along with doing that, we also like have been very focused and focused on long-term care facilities, providing materials at long-term care facilities that may help either physicians or other providers, the people living in the facility, and my favorite people to talk about, their caregivers, who are often the medical decision makers, to really take the approach of making sure that their loved ones are protected from these infections. So I think we're tracking it closely. We do report on how nursing homes are doing. Again, like we're at the beginning of the season, and so I think we'll see like what the effectiveness is of all of these interventions. But we're definitely like making a really important push that folks who are in nursing homes are at a higher risk for worse outcomes of flu, COVID, and RSV, and that these are vaccines that we know can prevent it.
Okay, next topic. What should we know about masks? I literally pulled this out of my bag because I will full disclosure, I still carry these are my favorite masks, the N95 masks. What can we say about masking? It seems like CDC has de-emphasized this a little bit in recent years. What do you I wear a mask when I go on when I'm at the airport, and I don't know if you do, if you want to share with us whether you do, but what do you advise? What can you talk a bit about? Is it
Sure.
you more? Does it protect other people more? What should the messaging be there, and where does the CDC stand?
Yeah. That's great. So I'm hoping that I know I have some folks with me. Like, this is a great time to put the respiratory virus guidance in the chat if people want to take a look at it. And so I'm not going to do that, because otherwise I'll disconnect or do something silly, since my technology skills will be poor where I'm standing. So in terms of what we've done is we've really changed our guidance, or updated it, to really look at all of the things that we can use to keep people healthy during respiratory virus season. And again, I'll say, it is about flu, COVID-19 and RSV, but it's also about the other ones that we may not have all of the same tools to address. So first and foremost on the list is vaccinate. So we know that's definitely really important. So getting people up to date with their vaccines. Like we know that if you improve ventilation, whether that means like open a window all the way to like add filtration systems to where you live. Like those things are really important. You've already talked about it. I've already talked about it. Hand hygiene, it's not just good for respiratory viruses, it's good for life. There's a lot of things that we improve with like washing our hands, which I think is really important. And then other sort of strategies include treatment for people if they could benefit from flu or COVID treatment. We talked about the if you're sick, stay home. And so just to remind people, that's 24 hours, fever-free or without symptoms. And then afterwards, 5 more days of things to try to reduce the possibility of transmission of any viruses. And those things can include the stuff I talked about, but also include additional precautions that people can layer on at any time. And that includes masking. It's on our list as something to add, like as a layered approach, using all the tools in the toolkit if it's appropriate for you and your context. Thinking about testing and how testing can potentially supplement decision making as well as also facilitate treatment. And then really, even if you're not staying home and you're not sick, like if you're in an environment, like, you know, even like a little bit of physical distance between people will end up being important. So really like where masking lives is in like what I think now is a really robust toolkit that people can use that, you know, to see what's right for them. Like, you know, I'll be honest, I don't mask everywhere. Like it depends on sort of what's happening. But when I had respiratory symptoms and I stayed home for a couple of days, I decided that when I go back to work, I was going to mask for a bit and follow the guidance of like 5 days, just to make sure that people were more, that I was like, you know, protecting my colleagues and my friends. But again, that's me. Other people could just choose to sort of create physical distance, you know, work, you know, close their office door. There's lots of ways that people can sort of address this and use that toolkit. So masking is there. Definitely something that can be added on to a layer, but it's never something that that lives alone without all the other things that we recommend.
Great. And then there's one thing that we have not talked about that I want to bring up that we have, it hasn't even been mentioned yet, which is long COVID. Is
Yeah.
long COVID still a serious risk that we need? Like, I don't know how serious or how high a likelihood the risk of long COVID is with the current variants, or whether that was more of a first and second wave thing. And people who have long COVID, there's literally thousands of them, maybe well, tens of thousands of them, maybe millions of them. You know, is there anything extra they should be doing to protect themselves? I think most of them are probably already wearing masks and getting their vaccines and everything, but do we have a sense of what the risk is? Is this still something we should be reminding people is a risk that they want to avoid, and whether vaccination reduces that risk? What should the messaging be there?
Yeah. So long COVID is definitely like a major concern. And I just want to sort of like highlight that, you know, we're really avidly following the research that's happening that NIH is doing to sort of see how we can, you know, better advise folks who have long COVID, what strategies can be to take better care of themselves and address some of the symptoms. Like, so that's number one. Is long COVID is like on the scene, definitely important. You know, we have seen some trend in decreases in long COVID over time, but I think that the most important thing that we can say to folks is that that we're seeing more and more data that supports that COVID-19 that COVID vaccine shot is like significantly important in reducing not only the acute manifestations of COVID, but also the long-term manifestations of COVID. So, you know, I think that I think is key. So I think, you know, again, go into our respiratory virus guidance, like thinking about if you're sick and have risk factors to get treated, and definitely use that vaccine because it doesn't just prevent you from being sick short-term, but also long-term.
Another question, you mentioned the return to work guidelines, and you gave a kind of a brief overview of those. I remember reading that there were going to be, or I think there were, if I remember correctly, that the CDC was working on return to school guidelines. And I didn't know if that was still something that was happening, if that's something we should expect. And I will admit, as the mom of two kids, one in junior high, one in elementary school, my son had COVID recently, and they were using, the school was sort of relying on the return to work guidelines, and I was trying to discuss with them that I didn't necessarily, me personally, didn't think that they were the appropriate thing for them to use, and you know, whether my son he was still positive, and can you just like, should we expect to see
Sure.
those school guidelines? What should parents be thinking? How should parents make those decisions? Obviously, if a kid's home with COVID, that means the parent has to stay home as well. So
Right. So we can definitely like make sure that we drop those in the link if we in this chat if we can find them. But yeah, new guidance, new school-based guidance came out that respiratory guidance is a part of. And so it is like a more global sort of school-based guidance for lots of infectious diseases, not only respiratory ones. And what they also did is they really refer back to our respiratory virus guidance as like the principal like strategy for kids in school as well. So that same guidance is embedded in the school guidance, but there's a bigger school guidance that talks about all the things, not only respiratory disease.
and when you say all the things, you're talking like neurovirus and like para-influenza,
like diarrheal illnesses and all of the things. Like so it's more of a yeah.
Okay, that makes sense. Last question, and it doesn't look like there's any other questions there. So last one for me, unless there's anything else you want to wrap up with, which is misinformation. Huge. We've addressed it a couple times. You've mentioned it a couple times. Are there any particular misconceptions that you guys are seeing more frequently come up that really need to be hammered a little bit more hard than other stuff that or specific areas within misinformation that you guys, I mean, I realize that journalists' role isn't to quote unquote help the CDC, but we do want to get good information out there that's accurate.
No, but I mean, like, bottom line is like people, you all like, again, like we're always happy to sort of take your feedback, take criticism and all that, but then also you are trusted messengers to so many people that like, I think that that's a great question. I feel like in general, what I've learned in my sort of vaccine and other preventative intervention career is that rather than picking one piece of misinformation or another piece of disinformation, what's important is just making sure that we like provide the system appropriate good information. And so I think that like the transparency, the risk less, do more, like the fact that like, yes, there could be side effects from vaccines, but the side effects of vaccines, even the rare ones, are like significantly less common than the real and present danger of what we know these viruses can do. So I feel like rather than sort of nitpicking on like one or another piece of misinformation, it's just making sure that we flood the system in effect with really good information that sort of focuses on the benefits. I think that like the whack-a-mole of chasing like one or another sort of piece of misinformation ends up not being particularly generative and creates like sort of like additional swirl that's unnecessary. So, I think again, focusing on the fact that like the vaccines work, they allow you to risk less, do more. I think that's like a really nice, clean message. And that we know that even if they don't prevent the infection, boy, they prevent grandma, grandpa from having to go to the ER on Thanksgiving instead of being at the Thanksgiving table. And I think that that's like the way to counter that by really providing high quality information that is also transparent about, what the chinks in the armor, because nothing is perfect. Even though I do believe that vaccines are medical miracles amongst sort of the ranks of sanitation and clean water, I do think that even miracles have their limits, and some miracles may also have like some imperfections. And so even in the imperfect world, I can tell you that the COVID and flu shots have literally saved millions of lives over the duration, with very few people who are experiencing long-term side effects from those vaccines. So that's how I would approach it, which is just, maximal transparency, because that whack-a-mole is pretty hard.
Excellent.
Risk less, do more.
Well, and I was actually just going to reemphasize that when, for more information, journalists have a great resource. You can visit the Risk Less, Do More newsroom. That's a literal newsroom. You can see that in the chat there. We will add that to our webinar page along with some other helpful CDC resources. But it's really, the CDC has worked hard, I know, at providing these resources. So I personally love that message. I'm not even trying to be like, I'm not trying to sound whatever it's called here. I actually love that because it fits in with what I've been telling people for years, which is, don't get it to prevent the infection, get it so you can literally go to work and do what you need to do. So check that out, that hhs.gov risk less do more with hyphens in there /newsroom. We'll add that to that. Thank you so much for joining us. We really appreciate it. A reminder to everyone, we've been here talking with Dr. Demetre Daskalakis. He is director of the CDC's National Immunization for CDC's National Center for Immunization and Respiratory Diseases. If you joined us late, you can always find a recording of this webinar at healthjournalism.org. It should be up there in a few hours. And I think you've already said your final word. Any last words you want to throw out there?
I feel like I have to do it one more time because I know how to point to the thing. Risk less, do more. Like, we're really excited to be here. And again, hopefully I've provided some good material and some good framing for folks to think about. We really appreciate like your the work that you all do to sort of make sure that folks have good information. So I think that's it. Thank you so much, Tara.
Great. Thank you so much, everybody. I'm trying to collect here the I'm going to collect these. There's a school preparedness in there as well link that has just been provided to us. So if you need to copy those over, go ahead and do that. Thank you, everyone, for joining us, and stay safe and healthy and get vaccinated and all that other fun stuff.